Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us. Going to have a conversation with Dr. David Slade. He's a national asthma expert, pulmonologist, and GSK Medical Affairs Lead on asthma. And he's joining us on the program to talk about how folks with severe asthma can manage that condition. He's joined by Donna Matlach. She's a ballroom dancer with severe asthma, and also the co-founder of the Severe Asthma Foundation. Welcome to Health Professional Radio, both Dr. David Slade and Donna Matlach.
Thank you so much, Neil. It's a pleasure.
Dr. Slade, you are a pulmonologist. Brief background, and what is asthma, and who does it affect the most?
So asthma is a chronic lung condition. You've got swelling or almost inflammation in the airways, as well as a tightening down of the air passages, which can result in things like Donna has experienced. So you get coughing, wheezing, shortness of breath. The symptoms aren't necessarily present all of the time. They can strike any time, and that's one of the things that makes it so scary.
So, Donna, you've got asthma. You're a ballroom dancer. That must be quite interesting to manage.
Absolutely. Asthma basically took over my life before I started getting answers and being able to control it. I was unable to do the things I normally do every day, walk the dogs, anything, much less dance or have the energy or the breath to do anything like that or exercise. So, yes, it took over my whole life.
You're managing what is known as severe asthma. Dr. Slade, you told us what asthma is. It's more severe than what you described? There's a condition that's more severe than that?
Absolutely. So you have about 10% of asthmatic patients who are severe asthmatics. These are typically people, as Donna can tell you, who need multiple medicines just to keep their symptoms at bay or to try to keep their symptoms at bay. They might have symptoms that wake them up at night, keep them from sleeping, or in the case of my wife, it was, can we park the car as close to the store as possible, because if I walk outside, I'm going to get short of breath.
Donna, when you say that these normal things, walking the dog, that's maybe 15 minutes to half an hour if you're, ambitious. You're saying that simple little things like that, would it debilitate you for the entire day, or you'd have to take a series of treatments and medications to continue what it was that you were doing? How did you manage?
Well, it started out that I had to take, my medication and my treatments. However, it got to a point where a simple thing, my aha moment was a simple thing like bending over to tie my shoes put me in the hospital. We could no longer control that at home with medications, which were not simple medications. And I was hospitalized for 8 days at a time. And severe asthma is very much like a firecracker. You light the wick, and it either fizzles out or it explodes into a full-blown asthma attack. You don't know when it's coming. You don't know how long it's going to last, or if you're going to be able to deal with it at home or need to go to an ER.
Dr. Slade, a lot of us, I'll speak for myself. I've seen, the movies where, the kid has asthma, has a little bit of trouble on the baseball field, and, they rally around and everything's okay. Apparently, this is not something that you always grow out of. Is it something that comes on as a child?
Actually, asthma can almost be anything that it wants to be. You have some children who are affected very early in life and then will carry symptoms throughout their life, up until adulthood and throughout. There are other people who might have symptoms, as in Donna's case, as a child. They seem to get better, and then it strikes again kind of with a vengeance. And then there are still other people who aren't diagnosed until they're adults.
How many people are living with asthma? What causes it? Is there something that we can do as patients, consumers, to stop asthma? It seems to be extremely prevalent. So
around 10% of the population in America, or 20 million people, have asthma. So as you said, it's a huge problem. I think a big thing that you can do is to be an advocate for yourself the way that Donna has done. There's a great resource, asthma.com, an e-guide. If you download that, spend some time. Don't let asthma make your world smaller and smaller, and talk to your doctor.
You mentioned, Donna, the asthma aha moment. For you say it was something as simple as bending over to tie a shoe. What advice do you have for people that are experiencing some of the symptoms that you had who aren't aware that, they've got a big problem that they're getting ready to deal with?
The advice I would give those people is know your body, know your lungs. When you have symptoms, write them down. Write the frequency, how long they lasted, what did you do to alleviate the symptoms? Did you have to go to the ER? What about a hospital stay? Just be your own advocate. Be the best you can to take care of your body. Don't be afraid to communicate with your physician and tell them what's going on. And when your physician prescribes a medication for you, be compliant. Even if you feel better, be compliant and take that medication. Continue to take it till, they tell you you're okay.
Dr. Slade, what is it that you and other physicians need to hear from a patient when they come in complaining of symptoms that some of which could be for a number of things, not necessarily asthma? And what is it that you would tell other doctors to listen for when patients are complaining of certain symptoms?
I think as health professionals, everyone is so busy. Patients are so busy. So I think it's when you go to see your doctor for asthma, tell them, as Donna said, everything that's happened to you, especially if there are things that you want to be doing or used to do that you can't do anymore or fear because of your asthma. I think it's one of the tricky things is, as an asthma patient, you feel your world growing smaller, but you don't necessarily tell your doctor about what you want to be doing. You sort of focus on what's bothered you yesterday. So keep that log, advocate for yourself, just like Donna's done.
Now, you mentioned a website, asthma.com, where lots of great information is there. Is there another resource where we can get some information? And in wrapping up a question, can severe asthma revert to, for lack of a better term, normal asthma? Or is that something that doesn't happen? Once it's severe, it's going to be severe, and those treatments, that management technique will be throughout a person's life.
So medically, when you're diagnosed with severe asthma, you might get to a point where periodically your symptoms aren't quite as heavy as they were other times. Unfortunately, once you have severe asthma, it doesn't revert back to sort of regular asthma or just plain asthma. It's always severe asthma.
Well, I thank you both for coming in this morning and speaking with us, Dr. David Slade and Donna Matlach. Thank you both for joining us here on Health Professional Radio.
Thank you, Neil.
Thank you so much. It's a pleasure, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.